The scientific consensus is building. This Omicron wave does look to be receding in at least a couple of states. In Victoria, total hospital admissions are back below 1,000, so a relatively quick turnaround there. But we also know that the worst of deaths in this wave are probably still before us. That curve will take longer to peak. We might also see some bouncing around in the coming days, especially early in the descent. That's what we've seen today in New South Wales, a state that had been slowing the hospitalisation trend over a couple of weeks. That firmly sped up in the back half of last week, and even with today's increase, the trend is still pointing in the right direction. Overall, the total number of patients in hospital in New South Wales has ended up being at the lowest end of the state government's modelling. These are the actual hospitalisation curve, and it resembles most closely of the scenarios that the state government modelled the South African experience, much lower than what we've seen in cities like New York. And the other thing is that as the number of patients in hospital starts to decrease, there's likely to actually be more healthcare workers available to care for them. The number of furloughed healthcare workers due to COVID exposure has stopped growing last week. And there are some other states that maybe haven't yet quite peaked, but look like they're well on the way to doing so. So watch these ones. Queensland, where hospitalisations visibly slowed in the last few days. Also South Australia, a similar trend there. Total now just under 300 people in hospital. Watch those states. Could they well be the next ones to peak? Something to watch for later in the week. And there's one state that hasn't yet seen a coronavirus hospitalisation curve at all yet with Omicron, and that's Western Australia, which has had more cases today, including a mystery. Never say never, but we know that when the virus gets into a state, it's pretty hard to get rid of it. It's in WA now, sooner than the state government had wanted.